Hello class, welcome to day 12A. This is the nervous system, chapter 22. As usual, we start with section 2. Some definitions. Neuron, that's the basic nerve cell of the nervous system. The nervous system, that's the central nervous system. Part of the nervous system made up of the brain and the spinal cord. You have the peripheral nervous system, which is made up that's the nerve system that runs throughout the body that connects to the spinal cord. You have the brain, another part of the nervous system that houses the skull, which is responsible for motor activity, memory, thought, speech, intelligence, regulates vital signs, and so on. The spinal cord, as you know, part of the nervous system that is in the vertebral canal, conducts messages between the brain and throughout the body. So that's the picture of the nervous system. You can see the nerves. It's just kind of like a network of nerves that carries information from the brain throughout the body. So the nervous system is divided into two main parts, the central nervous system and the peripheral nervous system. Again, points to remember about the nervous system consist of the brain and spinal cord. The brain controls speech, motor, sensory activity, intelligence, reasoning, coordination, reflexes, breathing, emotions, and heart rate. The spinal cord conducts messages between the brain and the rest of the body. So carries messages from the brain to the rest of the body, like we said. The somatic nervous system helps with conscious movement of the skeletal muscle. The two parts of the autonomic nervous system conserve body energy, provide relaxation of the body, activates the body to fight or flight in response to any kind of emergency. Points about the sense organs consist of the skin, the tongue. The skin helps you feel, the tongue helps you to taste things, the nose helps to smell, eyes sees, and ears hear things. Receive impulses from the environment and relay these impulses to the brain. Then the brain will take action in response to whatever the environment poses. For example, if the environment is very cold, it will send a message to the brain. Then the brain will react to the cold environment. The eye, you have the cornea, pupil, iris, sclera, the retina. Those are all parts of the eye. The sclera is the white section of the eye. The cornea, transparent front part of the sclera. The iris, the pupil, the retina. You can read through those. You have the ear. You have the outer ear, middle ear, and the inner ear. And then you have all the parts there. One thing that people do a lot that is wrong is stick an object in their ear to try to clean it. A pen. I've seen somebody put like a little knife. Not good. So be careful. Parts of the ear. We talk about the outer ear, middle, inner, the eardrum, and the ossicles. Function of the nervous system controls and coordinates mental processes and voluntary movement. So that's like the engine of the body, processes a lot of things that you do. Provide reflex centers of heartbeat and respiration, senses and response to changes. We talked about the environmental changes and how the brain will react to it. Responses and reflexes. Okay, this section here is always the important section when we're talking about the systems of the body. How does it affect the elderly? Normal changes in the aging process, as far as the nervous system is concerned. Responses and reflexes slows down. If you can pinch a resident and they might not feel it and respond, compared to if you pinch somebody younger, they'll be like, ouch. Some memory loss will start occurring, especially short-term memory. Sensitivity to nerve endings in the skin decreases, resulting in diminished sense of touch, like I said earlier. Some hearing loss will occur. Sense of vision, smell, and taste will weaken. We have cerebrovascular accident, which is also called a stroke or CVA. That's a condition caused when blood supply to the brain is cut off suddenly, either by a clot or some kind of accident. And then the person goes into stroke, which would then result into, paralysis, either left side paralysis or right side paralysis. We'll talk about those later. Hemianopsia, loss of vision on one half of the visual field due to stroke or tumor or trauma. So points to know about stroke, CVA. What causes it? Obstruction inside the blood vessel or the rupture of blood vessel that then cut off supply of blood to the brain. You have ischemic stroke, which is the common one. This type of stroke, the blood supply is blocked and the brain cells begin to die. Hemorrhagic stroke is another type of stroke, occurs when there is leaking or a rupture of blood vessel inside the brain. And you have transient ischemic attack, TIA. It's kind of a warning sign that before stroke happens. Symptoms differ depending on which side of the brain it's affected. Some problems that can result from right side or left side brain damage from stroke. Hemiparesis, hemiplegia, one-sided neglect, loss of ability to identify affected body parts, expressive aphasia. We'll talk more about this shortly. Receptive aphasia, emotional liability, loss of sensations, loss of bowel or bladder control, cognitive impairment, changes in personality, loss of thinking and learning, dysphagia or total inability to swallow, vision impairment or blurred vision, hemianopsia. So how do we take care of a resident with stroke? These are the guidelines. Encourage the residents to be as independent as possible to promote self-esteem. Be patient with care, especially when communicating. They're going to be slow in responding. Remember, they had a stroke that affected the brain, and then that affected different functions that the brain used to process. So now everything is slower, so be patient. Encourage resting in between tasks. When they do one thing, they rest before doing another thing. Assist them with exercises, range of motion. Reposition them often. Remember, they have a weak side. They're not able to turn and reposition themselves. So we don't want to have skin breakdown or more damage to the body or the muscle because they cannot move, they cannot turn. And always do not use the weak side. Don't say it's a bad side. Always say the weak side or the strong side. Assist with ambulation to prevent fall. Remember, they have one-sided weakness. So when you're assisting them to walk, you're going to stand on the side that is weak. and use a gait belt. For one-sided neglect, remind residents about weaker side of the body. Some of them might not remember, and then they might try to, they might not remember how to put their leg forward. So if they have a weak side and a strong side, and they're trying to walk, the strong side should go first, then the weak side follows. So you have to remind them. Always place food on the unaffected side of the mouth. Observe for swallowing problems. Encourage fluids and proper nutrition. Be careful when shaving them and grooming them and bathing them. Make sure a clock or calendar is visible so that they can see and know what time it is, know the date. With emotional liability, redirect the residents' attention. When they start feeling sorry about themselves or start expressing depression, try to redirect them to have a conversation about something more positive so that, they don't continue to feel bad or feel depressed. Try to praise them often. So say, Miss Susie, you're doing good. You're making progress. Don't worry. Just keep taking small steps one day at a time. Listen to them when they want to talk about something that's bothering them. Again, with guidelines for communication after stroke, speak clearly and face the residents. Do not rush them. Use signals such as nodding, pointing. Use yes or no. Use yes or no questions so that you're not stressing them with long explanation. Ask them questions that they can nod or they can answer. Keep questions and directions simple. Use special methods such as a communication board. So let's talk about some common disorders of the nervous system. Parkinson's disease, you've heard about that. A progressive disease that causes a portion of the brain to degenerate. It causes rigid muscles, shuffling gaits, pill rolling, mask-like face, and tremors. They'll be shaking. They cannot hold on to anything. Their hands will just be shaking. Their fingers will be shaking. When something is progressive, that means that it continues to get worse and deteriorate over time. So points to know about Parkinson's disease. It's a progressive disorder. Again, what causes it? Neurons in the brain that produces dopamine begins to break down and die. Symptoms, tremors or shaking, like we said. The treatment, there are some medications that are prescribed for the resident, but that's for the nurse to be concerned about. Sometimes there's surgery done. So guidelines for Parkinson's disease when you're providing care. Again, you will always encourage residents to do for themselves as much as possible, but you're right there supervising and assisting them. Assist with activities of daily living, assist with range of motion exercises, assist with ambulation. Again, prevent fall. They could fall easily. Encourage residents to stand as straight as possible for ambulation. Encourage fluids and proper nutrition. Listen to the residents, see if they want to talk. Report severe trembling. If their condition gets worse, just report it to the charge nurse. Multiple sclerosis. Again, it's a progressive disease whereby the protective covering of the nerve, spinal cord, and the white matter of the brain breaks down over time. And without that covering, the nerves cannot send messages clearly to the brain and the rest of the body. Points to know about multiple sclerosis. It's also called MS. Again, it's progressive. We said that loss of that myelin, that covering that we talked about. Symptoms include numbness, tingling, muscle weakness, extreme fatigue, tremors, vertigo, reduced sensation, blurred vision, and so on. there's medication for treatment. Guidelines for MS: be patient with self-care. Again, offer periods of rest, assist with exercises, encourage residents to follow exercise program, assist with ambulation to prevent fall. Again, encourage proper nutrition and fluid intake. Do not rush communication. Try to provide stress-free environment. Offer support. Report any changes to the charge nurse. Some other conditions that affect the nervous system: concussion. That's a head injury that occurs from a banging movement of the brain against the skull. If you watch American football, this happens a lot when you have, how you have the one team line up against the other team and they have their helmets on, and then when they start the play, they go head to head. The offensive line and the defensive line, they'll just bump each other in the head. Sometimes, they get concussion from that. Paraplegia is loss of function of the lower body and legs. So like from the waist down, there is no function. And quadriplegia, loss of function of the legs, the trunk, and the arms. That's like from the neck down, there is no function, there is paralysis. So from neck down is quadriplegia. From the waist down is paraplegia. We're still talking about common disorders of the nervous system. Points to know about head injury and spinal cord injuries. What causes it? Accidents, gunshots, stab wounds, falls. Some people can fall and hit their head and can't remember where they are or who they are. Again, we talk about head injury. Again, confusion, disorientation, coma. Those are the symptoms. Okay. Again, guideline for providing care to somebody with a head injury, spinal cord. Allow as much independence as possible with ADL. We talked about fall incident reports, that was day 10A, and we said that if somebody's on the floor, they have fallen, you don't know if they have hit their head, then do not move them until you've called the charge nurse to assess them, because you don't know how much injury they have had already. If you move them, then you're going to make the injury worse. So remember that. Offer rest periods as necessary, perform range of motion, give frequent care, be gentle when turning or repositioning them, protect residents from harm due to lack of sensation, check water temperature carefully before you use the water on them, use special stockings to increase circulation. We talked about elastic stocking, or it's also called TED stocking, or anti-embolic stockings. It helps blood flow circulation in the lower extremities, like prevent swollen legs. Encourage fluids and proper diet. Give careful cataract care if the person is on catheter. Help with bladder and bowel training. Encourage deep breathing exercises. Provide privacy. Listen to the resident. Report any changes to the charge nurse. Okay. Epilepsy. Epilepsy is also called seizure, disorder that causes frequent seizures. Points to know about seizures: it's an involuntary contraction of the muscle. What causes it? Tremors, head injury, injury to the brain, stroke, dementia, genetic factors, and so on. Alcohol and drug abuse causes seizures also. Treatments: there are several medications for seizure, surgery, rehabilitation. One thing with seizure you should know as a CNA: when the seizure starts, just move things away from them that could cause injury. You cannot stop the seizure. Just stay with them until the seizure stops. Normally it will take like 2 to 3 minutes. The seizure will stop. Nearsightedness and farsightedness. That's the ability to see objects that are near more clearly than objects from a distance. It's also called myopia. Farsightedness, ability to see things at a distance more clearly than objects that are near. This one is called hyperopia. So I wear glasses and I cannot see, I don't read with glasses, but I cannot drive without my glasses. So I cannot see far, so I can only see things that are closer to me. Vision changes that affect, vision changes affect all ages. My children wear glasses as well. So it's not about age that affects sight. Cataract, condition in which the lens of the eye becomes cloudy, causing loss of vision. And what causes it develops, that points to know about cataracts, develops when the lenses of the eye becomes cloudy. What causes it? Diabetes, eye injury, sometimes it's inherited. Symptoms include blurred vision, glare when driving at night, yellowing of vision. There's surgery that can be done. Glaucoma, a condition in which the pressure in the eye increases, damaging the optic nerve and causing blindness. Points about glaucoma, leading cause of blindness in the United States. What causes it? Intraocular pressure increases, damaging the optic nerve. The majority of people have open angle or primary glaucoma. Symptoms of open angle glaucoma, not always apparent, but over time there's a decrease in vision, especially in the peripheral vision. Another form of glaucoma is single closure, which can be chronic or acute. Symptoms include pain, nausea, vomiting, seeing a halo around the light, reddening of the eye, blurred vision. Treatment, eye drops and other medications. Then there's surgery that can be done. Age-related macular degeneration. And some of these terms are just for general knowledge. As a CNA, you're not going to be memorizing all of this, but just general knowledge, especially for those of you planning to move on to do nursing. Points about age-related macular degeneration, condition in which part of the retina degenerates. There are two forms, wet and dry. Risk factors, aging, smoking, sun exposure, heredity, gender, and race. Treatment, laser surgery, injections, zinc, and antioxidants. Again, guidelines for vision impairment: encourage use of glasses, keep eyeglasses clean and safe. Glasses is part of their dressing. If they wear eyeglasses, you must put the eyeglasses on when you dress them up. Change cases for contact lenses regularly if you're wearing contacts. Always identify yourself as you enter the room. Keep doors completely open and closed. We did cover visual impairments in another chapter. Remember, if somebody's blind, how to make sure you put things in a clockwise position. We're still talking about guidelines for vision impairments. Leave furniture in place. They already know how things are placed in the room, so don't move things. Use the face of an imaginary clock to explain the position of objects in the room. Make sure there's enough lighting in the room. Always walk ahead of them when you're walking them, and walk at their pace. Assist residents to complete menus and so on. Use large print books if they want to read. You can use audiobooks as well. Read to them if they want. Assist with vision screening. Okay, care for eyeglasses. You can read through this in your book. Some residents have artificial eye on, and it's a type of prosthetic and does not provide vision. Is just for just for decoration, I guess, just to make them look more normal. Necessary for people who have lost an eye to cancer or other disease. Most are often from plastic. They are made of plastic rather. Make sure they are held in place by suction. Carefully follow the care instruction if you have it on. Do not use alcohol to clean it. Always act professionally during care. Keep eyes covered completely in solution when stored. Some definitions: otitis media, Meniere's disease, hearing aids. You can read through that. Okay. Otitis media is an infection in the middle ear. Okay. Symptoms: pressure, pain, fever, reduced ability to hear. Some antibiotics can treat that. Meniere's disease, buildup of fluid in the inner ear caused by infection. Symptoms: vertigo, hearing loss. Then they have medications to treat it. Guidelines for hearing aids. Be careful when handling a hearing aid. Turn the volume down before inserting it into the ear. Turn it off when it's not being used. Replace the batteries as needed. Do not put it in water. And remove the hearing aid before they take a shower. Okay. Do not spray hairspray on it. Check for hearing aids before removing bed linen. Sometimes the hearing aid fall off on the bed, and then you pick up the bed sheets and covers and put them in the laundry basket with the hearing aid in it. So always check. Report any signs of sores or abrasion in the ear to the charge nurse. Still talking about disorders of the nervous system. Obesity, it increases the risk factor for certain nervous system diseases and disorders, including stroke, anxiety, and depression. Sometimes cognition, dementia, irreversible. Cognition is the ability to think clearly and logically. Dementia is a serious progressive loss of mental ability, such as thinking and remembering and reasoning. Irreversible means that it cannot be turned back, it cannot be improved. So remember, dementia is not a normal part of aging. Okay. Causes of dementia: Alzheimer's disease, vascular dementia, Lewy body dementia, Parkinson's disease, AIDS, Huntington's disease, excessive alcohol or drug use, head injuries, thyroid disorders, nutritional deficiencies. Some forms of dementia may be treated. However, many forms of dementia are irreversible. Alzheimer's disease. So pay attention to this section here, because Alzheimer's is you're gonna come across a lot of residents that have Alzheimer's disease. It's a progressive, degenerative, incurable disease that causes protein to build up in and around nerve cells, which results in memory loss, cognitive impairment, and behavioral changes. The behavioral changes is where we have challenges while dealing with providing care to Alzheimer's disease residents. Okay. Points about Alzheimer's disease, also called AD. It's progressive, it's irreversible. Occurs when tangled nerve fibers and protein deposits form in the brain. The cause is unknown. Older skills are usually kept longer. They'll still remember to do certain things like ride a bike or sing or things like that. Things that they have learned before. Alzheimer's Association identifies three three general stages of Alzheimer's disease. There's the early stage, and there's the early stage, there's the middle stage. You can read through this in your book. There's the late stage. Let's talk about the late stage. Final stage, person may be unable to communicate with others, unable to control movement, or respond to his surroundings. So they need significant help to provide activities of daily living, eating and toileting and so on. Ability to walk, sit, or swallow may be affected. So how different is a resident's ability for self-care when she moves from middle stage, moderate, late stage disease? So remember, every victim progresses differently through the Alzheimer's disease, showing different symptoms at different times. It is important for nursing assistants to encourage independence regardless what signs and symptoms a resident with Alzheimer's shows. Walking, socializing, reading, problem solving, exercising should all be encouraged by the residents. So have them do as much as possible for themselves. Okay. Perseveration. The repetition of words, phrases, questions, or action. So guidelines for communicating with residents with Alzheimer's disease. Always identify yourself and greet them by name. Look at the resident when you're speaking to them. Speak slowly and quietly. Reduce background noise. Use touch and gestures to get their attention. Only talk about one subject at a time so they can remember. Repeat directions and answers as many times as needed. Use pictures. Praise them often. So strategies for better communication with Alzheimer's residents. If resident is frightened or anxious, move and speak slowly. Speak in a quiet area with few distractions. Try and see yourself as they might. Use simple language and short sentences. Check your body language as well. Okay. If resident forgets or shows memory loss, repeat yourself in the same words. Do not try to stop a resident who is perseverating. They keep repeating what they're saying. Keep messages simple. Break complex tasks into smaller, simpler steps. If a resident has trouble finding words or names, suggest a word that sounds correct. Use touch if it is welcomed. We're still talking about communication with residents with Alzheimer's disease. Ask residents to repeat your statement to see whether they understand you. Pay attention to communication methods that are useful. Watch for non-verbal cues. Use signs, pictures, gestures, or written messages. If the resident wants to say something but cannot, encourage residents to point to what they're trying to say. Gestures or act it out. Offer comforts or try to distract the resident. If resident is disoriented to time and place, post reminders in early stages. Put a calendar on the wall and a wall clock so that they can see, or you can point to them. If resident does not remember how to perform basic tasks, break down the task into simple steps. Okay. For example, you want to assist them to brush their teeth. So you're going to say, okay, pick up your brush, open the toothpaste, put the toothpaste on the brush. Don't say, Miss Susie, here's your brush your teeth. They might not remember what to do with the brush. They might not remember that they need to put the toothpaste on the brush. So you need to take one step at a time. If the resident insists on doing something that is unsafe or not allowed, try to limit saying don't. Just redirect them into doing something positive. If the resident is hallucinating or paranoid or accusing you, Sometimes they could say that you've taken their money. You know, even if they may have given it to you, that's why you don't take money from the resident. Do not take it personal. Try to redirect them or ignore the behavior. If the resident is depressed or lonely, take time to ask how the resident feels, listen to them closely. Try to involve them in activities, take them out for a walk. If the resident repeatedly asks to go home, which they're going to do, they're going to want to open every door, try to leave the building. Ask the resident to tell you what home was like and how he felt being there. Redirect the conversation to something the resident enjoys. Expect that the resident may continue to ask to go home. If the resident is verbally abusive or uses bad language, remember it is the dementia speaking and not the resident, so don't take it personal. They might call you names. I've been called many names, but I know that, I don't take it personal because there's a medical reason that causes them to behave like that. Try to ignore the language and redirect the attention. If the resident has lost most verbal skills, use non-verbal communication. Assume that resident is aware of losses in abilities. Burnout, mental or physical exhaustion due to a prolonged period of stress and frustration. We're all human beings, we get burnout, we get tired, just burn out. So that means it's time to take a break, time to rest. Personal attitudes. Identify personal attitudes that are helpful in caring for residents with Alzheimer's disease. Do not take it personally. Be empathetic. Put yourself in that position. Work with the symptoms and behaviors that are noted. Work as a team. Be aware of difficulties associated with caregiving. Work with family members. Remember the goals of the care plan. Can you think of a situation in which each attitude listed on the previous slide, these attitudes, might be helpful on the job? Okay, guidelines for bathing Alzheimer's residents. Schedule bathing when resident is least agitated. Be organized. Prepare resident before bathing. Walk the resident down the hall. Stop at the bathtub. Make sure bathroom is well lit. Provide privacy. Be calm. Be calm and quiet. Be patient. Keep the process simple. Do it fast. Offer the resident a washcloth to hold. Ensure safety. Do not try to force the resident to bathe. Allow resident to enjoy the bath. Be encouraging and positive. Be smiling. Make it fun. Observe the skin as well. Report changes to charge nurse. Guidelines for grooming and dressing. Assist with grooming to help residents feel attractive and dignified. Avoid delays or interruptions. Show residents the clothing. Always give them a choice to choose one or the other. Provide privacy. Encourage residents to pick out clothing. Do not rush them. Praise and encourage residents as often. So guidelines for toileting. Encourage fluids. Mark the bathroom with a sign. Check for episodes of incontinence. Observe toilet patterns. Take residents to bathroom before meals and at bedtime. Put lids on garbage cans or waste baskets so that they don't put your hands in the trash can. Follow toileting schedule. Support family and friends. Guidelines for nutrition. Encourage nutritious food. Schedule meals at the same time each day with familiar food. Make sure there is proper lighting. Keep noise and distractions low. Keep tasks of eating simple. Avoid steaming or hot food. Use plain plates without patterns or colors. Put only one item of food on the plate at a time. Again, give simple, clear instructions, guide residents through meals, use assistive devices, make meal times simple and fun. Sit residents with others to encourage socializing, observe and report changes, promptly report changes in intake or output. Guidelines for physical health, prevent infection and follow standard precaution, help residents wash hands, report potential problems, reduce risk of falls, provide excellent skin care, watch and report signs of pain. Emotional health, help them maintain self-esteem by praising them. Oh, Miss Susie, you look beautiful. Your hair look nice. Your dress look beautiful. Share in enjoyable activities. Reward positive and independent behavior with smiles and warm touches. So we're still talking about guidelines for problems with common activities of daily living. So remember rights. Remember this point about residents' rights. Residents with Alzheimer's disease, no matter what disease they have, they still have their rights. So residents with Alzheimer's disease might not be aware of what they are doing. And so it is especially important to protect their dignity as, for example, if a resident lifts up her skirt often, she should be wearing pants. If a resident is a messy eater, he should have privacy when he's eating. Nursing assistants should be active in protecting residents' privacy and promote their dignity and self-esteem, even when it seems they are not aware of it. Intervention, a way to change action or development. Agitated, state of being excited, triggers, situations that leads to agitation. What triggered the resident to become upset? Then we need to take care of those triggers. Agitation, feeling insecure, frustrated. Intervention, recognize and eliminate the triggers. Catastrophic reaction, reacting to something in an unreasonable, exaggerated way. Something was not a big deal, but then you raise hell out of control, you keep going on and on. It was not a big deal. So avoid catastrophic reactions. We sometimes, overreact to things as well. Okay. Violence, forceful action that include attacking, hitting, or threatening someone. Violent behaviors. Hallucination, seeing or hearing or smelling or tasting or feeling things that are not there. Okay. Delusion, a belief in something that is not true or is out of touch with reality. So hallucinations and delusions, interventions, ignore the behavior, reassure residents, do not argue with them, redirect residents to other activities. Okay. Depression causes loss of independence, facing incurable disease, feelings of failure, fear, chemical imbalance. Intervention, report to the nurse, listen to them if they want to talk about it. Disruptive behavior, any behavior that disturbs others. Okay. Inappropriate sexual behavior. Okay. Talk about that. Inappropriate social behavior. Again, do not take it personal when let's go back to inappropriate sexual behavior. Direct the resident to a private area, distract them, report to the charge nurse. Be careful also when you're approaching them. Once you know that they have those kind of inappropriate sexual behavior, they might touch mostly the male resident might touch the female resident, the breast or in the butt. They still have those kind of feelings, but remember they have Alzheimer's. Don't take it personal. So always kind of keep a safe distance with the resident, with such resident. Pillaging, taking things that belong to someone else, is a fancy word for stealing, but they're not stealing it in the sense of stealing something. They'll just take things, that doesn't belong to them. They'll just take it. Sometimes they'll take it from one position and leave it in another position. So it's called pillaging. Hoarding, collecting and putting things away, and just piling up things until, we do that too. I'm sure if you go into your closet, you have things you've been collecting and putting away for a long time that you don't use. Rummaging, going through items that belong to other people. Okay, so read through that. Sundowning, a condition in which a person gets restless, agitated in the late afternoon, in the evening, or in the night. In the morning they are fine, but once the sun comes up, they start getting restless and agitated. That's called sundowning. Causes of sundowning: hunger, fatigue, change in routine or caregiver. Intervention: provide adequate lighting, avoid stressful situation, play soft music, and so on. Sometimes there are suspicions. Suspicion, intervention do not argue, offer calm reassurance, be understanding. They might say that, they suspect that you're going to kill them, or things like that. Pacing, wandering, and elopement. Remember these three words because, there are three things that the Alzheimer's do the most. They'll be walking up and down, back and forth the area, wandering, just trying to go everywhere in the facility. They'll be filling every door, trying to elope, which is the elopement, where they want to leave the building. Okay. So pacing and wandering, we just talked about that. Why can caring for someone with Alzheimer's disease be very difficult? It's challenging. Some of our students that are working with residents that have Alzheimer's disease, they report back so many stories of challenges that they go through. It's a situation, it's a condition, and they still have to be cared for. Residents with AD may exhibit frustrating behaviors. Nursing assistant must never abuse residents in any way. And sometimes there's temptation to hit them or abuse them because they're driving you crazy, but it's not of their doing. It's just a medical situation. So you still have to be patient, be calm, report to the charge nurse. Okay. So activities for residents with Alzheimer's: encourage family participation, limit some activities to small groups, use quiet areas, set short time frames for activities, plan events that they like to be involved in, encourage exercises, encourage specific skills that they know, read and play music for those that cannot move around. Validation therapy. Validating is a type of therapy that lets people with Alzheimer's disease believe they are living in the past or in an imaginary circumstances. So validating, giving value to or approving something. Reminiscence therapy and remotivation therapy. Type of therapy that encourages people with Alzheimer's disease to remember and talk about the past. Remotivation therapy, type of therapy that promotes self-esteem, self-awareness, and socialization. Okay. Then we have orientation therapy. Reality orientation uses calendars, clocks, signs, and lists to reorient students to who they are, where they are, and what time it is. Okay. Can you think about a situation when each type of therapy would be most helpful? Mental health, mental illness. Okay. Generalized anxiety disorder, psychotherapy, cognitive behavioral therapy. I'm going to skip through some of these. Okay. They're kind of more of for the child nurses. Social anxiety disorder, a disorder in which a person has excessive anxiety about social situations, also called social phobia. Panic disorder, it's a type of an anxiety disorder that causes a person to have repeated episodes of intense fear that something bad is going to happen to them. Then you have obsessive compulsive disorder. This is a disorder where somebody just repeatedly thinking or behaving in the same way over and over. Like you can have a resident wash their hands 10 times because they fear that there's some kind of disease going on. Now PTSD is real, post-traumatic stress disorder. This is caused by some traumatic experience somebody had, especially those in the military when they come back from war zones where they heard gunshots over and over. They themselves fired guns at the enemy over and over. They saw their friends get killed beside them. Some of them took bullets and survived. Some of them, their leg got cut off. So when they come back home, they will still be hearing gunshots. Any small sound, maybe somebody closed the door, they might jump up as if there was a gunshot, maybe like an enemy gunshot. They're still thinking